SPECT MPI, or Single Photon Emission Computed Tomography Myocardial Perfusion Imaging, is a versatile diagnostic tool that plays a critical role in the evaluation and management of heart disease. In this video, we'll explore the key clinical applications of SPECT MPI, from diagnosing coronary artery disease to guiding complex treatment decisions. SPECT MPI is widely used to determine if chest pain or anginal symptoms are due to myocardial ischemia caused by obstructive coronary artery disease. For patients who don't experience typical chest pain, such as those with diabetes, SPECT MPI helps in detecting silent ischemia. By evaluating the severity and extent of ischemia, SPECT MPI stratifies the risk of future cardiac events, such as heart attacks. After a heart attack, SPECT MPI assesses the extent of myocardial damage and identifies residual ischemia, crucial for prognosis and management. SPECT MPI helps pinpoint areas of the heart that are ischemic but still viable, guiding decisions on revascularization procedures like PCI or CABG. Post-procedure, SPECT MPI assesses whether perfusion has improved and if ischemia has been relieved. In patients with severe CAD and reduced left ventricular function, SPECT MPI distinguishes between viable and non-viable myocardium, helping decide if revascularization might improve heart function. For patients with known or suspected CAD who are scheduled for major non-cardiac surgery, SPECT MPI helps assess the risk of perioperative cardiac events, guiding surgical planning. SPECT MPI evaluates left ventricular ejection fraction and wall motion, key parameters in assessing overall cardiac function. It also helps determine if ischemic heart disease is the cause of heart failure and guides further management strategies. SPECT MPI monitors the effectiveness of medical therapy in patients with CAD, especially those with recurrent symptoms. It also evaluates the impact of lifestyle changes, such as smoking cessation, diet, and exercise, on myocardial perfusion. SPECT MPI is particularly useful in women, who often present with atypical symptoms, ensuring accurate diagnosis and avoiding misdiagnosis. In patients with LBBB, SPECT MPI helps clarify perfusion abnormalities that are difficult to assess with other stress testing methods. SPECT MPI is frequently used in clinical research to study the effects of new therapies or interventions on myocardial perfusion and cardiac outcomes. It also evaluates the impact of investigational drugs on myocardial blood flow and heart function. For patients with symptoms of CAD, but no significant blockages in major coronary arteries, SPECT MPI helps evaluate coronary microvascular dysfunction and guides management. In heart transplant patients, SPECT MPI is used to assess for cardiac allograft vasculopathy, a form of coronary artery disease that can develop in transplanted hearts. SPECT MPI may be used in specific cases of congenital or structural heart disease to evaluate myocardial perfusion and guide treatment. SPECT MPI is a crucial diagnostic tool in cardiology, providing essential insights into the diagnosis and management of coronary artery disease, myocardial viability, and overall cardiac function. Thank you for watching. Consult with your healthcare provider to see if SPECT MPI is appropriate for your condition and how it can guide your treatment decisions.